This
Safety
conference will now be recorded.
My name is Brian Hahn, and I'm the CEO of BILD Calgary Region. As you just heard, this conference will be recorded and available later today on our website. Before we get started, I ask that everyone mute their microphones. That way everyone can hear the presenters. Also, to preserve bandwidth that is, we ask that you turn off your camera feed. You should still be able to see the screen and everything that gets prevented. Using the chat feature of GoToMeeting, you can ask questions at any time during the presentation. When you do, we would be grateful if you would include your name and company. We will endeavor to go through all the questions we receive and include as many as we can in the Q&A period at the end of our speaker's presentation this morning. In the event that we are unable to get to your question or don't have an answer today, we can use your name and company to find a way to get the answer to you. The Calgary region has officially moved into phase 1 of an economic relaunch. While this is very good news, its success is dependent upon adherence to guidelines for safe distancing and the proper use of PPE. As we begin to interact with more people, the risk of contagion and infection grows. So we need to be very prudent and careful as we enter this phase. While we hope for a successful relaunch for show homes, showrooms, and service and warranty work, that success hinges on appropriate planning. Ultimately, it is up to businesses to manage how customer interactions take place. And we certainly want to avoid the uneven success in other jurisdictions. And I note that Alberta Health has cautioned that restrictions could be reimposed if the current positive trends reverse. A frequent guest of these safety forums, Ernest Kremers returns today to provide some insight and advice on what is at stake and some information regarding the challenges that perhaps you have not considered. Ernest is the owner of Kremers Safety Limited, a safety consultant organization that helps companies across Canada with safety compliance and certification, as well as implementation and management of safety systems and safety training programs. He has also been a safety consultant for 18 years and is a contract instructor with the Alberta Construction Safety Association and has been doing that for 8 years. Thank you for joining us once again this week, and welcome to you, Ernest. And I'm going to pass over the presentation screen to you here.
Thank you, Brian. Welcome, everybody. It's a pleasure to be here and a privilege again. Just wait for Brian to be able to let me do that. That'd be great. If everyone could turn off their cameras as well, that'd be great, because we want to be efficient in our bandwidth. That'd be awesome. And again, so.
You should have it now, Ernest.
There we go. Good morning, everyone. It's a pleasure to be here. Today, what we want to talk about is some of what we're dealing with. We are now a couple of months into this whole process or more, and we're going to look at show home rooms, facilities, and some warranty procedures, information sharing, so that we can have a good conversation and maybe get you to have some information to take back with you that you may have not thought about. Again, the chat is going to be an excellent forum for us to answer questions today. And of course, we're going to look at the second wave a little bit, prevention as well. So our key points today, we're going to look at the numbers update, we've added the national numbers because I want to really take a look at how well we're doing compared to some of the areas. So we're going to look at the national provincial numbers, some of the challenges we're looking at with reopening the economy. We're going to go through a step-by-step process on show home and room procedures, and we're also going to add those warranty and service challenges, how to be able to mitigate those so that we can be effective in meeting the needs of our clients. And then what should we do for the second wave prevention? So our national numbers, we have 36.99 million inhabitants in this wonderful country we call Canada. And as of right now, we've had approximately 3.9% of the population tested. So Canada total has an 85,711 cases, and the tragic number on the right-hand column there of 6,545. We just want to send all of our condolences to all of those who are dealing with these losses, and it's just an absolute tragedy. But as you can see, Quebec and Ontario have approximately 86.2% of the confirmed cases and 94.7% of the actual fatalities. And we've put Alberta, British Columbia, Nova Scotia, and Saskatchewan on here because those are the next numbers. And as you can see that we are third. Our fatality rate is not as high as others, but there's still loss. And then British Columbia, Nova Scotia, Saskatchewan, and Manitoba is very similar, and the other ones really go down from there. But I just wanted to look where we are at. Now, one thing we need to understand with the flattening of the curve, it looks like Alberta is in a position where that curve is starting to flatten, which is great news. However, in Quebec and Ontario, the numbers are still rising, and I know that the health people are very concerned with that. So let's take a look at Alberta specifically. So we have a 6,879 cases with the tragic 138 fatalities, and the Calgary and South Zone make up 87.2% of the confirmed cases at the moment, with 109 fatalities between the two, which is 79%, and it goes down from there. Now, the reason that I want you to show this, that when we're working in Calgary, the opportunity for community transmission is that's much higher than South Zone, Edmonton, North, Central, and such. So we want to make sure that we understand that we're working in a higher risk environment than the rest of the province, and therefore the protocols we put into place are there to start bringing those numbers down. So reopening the economy, BizConnect. A lot of the information that you're going to hear today, ladies and gentlemen, is found on BizConnect. I know that BILD Calgary has all of these URLs on the website, and I would highly recommend you have a look at those because there's some really good information, not just what we're talking about today, but other information that can really assist you to minimize exposure to your workforce. It has been a difficult restart, especially in Calgary area, as everyone was set to go. And all of a sudden the brakes were put on, and that we also want to talk about later on in the second wave, that there could be that restriction again in the future, and that we should prepare for that as well, should those numbers spike again. And as Brian so capably said, we have a phase 1, 2, and 3 opening. And so we are now in phase 1. And so that, as we were watching news yesterday, hair salons were fully PPE'd, all of their workers and customers. They have a reduced capacity of 50%. It was wonderful to see that 17th Avenue had their courtyard and street side cafes open again. Some of the concerning issues is all of the staff was PPE'd. However, there was a lot of lack of PPE everywhere else, and I recognize that we need to talk about a little later on because that has to do with customer compliance. Now, costs. It was stated on the news and the radio that one dental office added $10 to the bill for each client for COVID costs. Some hair salons have added 30% to their bills because of COVID costs, and there are some that are not charging that. But I think every one of us recognizes that there have been added costs due to time constraints, the amount of people in our businesses, our new protocols, and all of that has taken time, effort, and any time that we do that, there's a cost involved to it. Customer compliance, that is going to be the next phase that we're really going to have to look at to make sure, that we protect our workers, but that we also protect our customers, right? And in some cases, there's still been some pushback and some lack of knowledge and lack of compliance. My general manager was at re-registering one of his vehicles, and he was in a lineup outside, and there was supposed to be 2 meters distancing. He was fully PPE'd with a mask, and he was the one out of 15 that had a mask on in public, which is concerning to myself. But there was one person right behind him that was not social distant, was right very close to him. So he politely suggested to the person that could you just back off and such. The facility itself had great compliance with sanitizers available, proper flow, and everything else. So the customer compliance is going to be a very big issue because it could put our workers at risk. So wearing masks, it should be the new normal. One of the things that we should be doing is every time that we see someone that's wearing a mask, because the compliance is still not there. Whenever we've gone to major grocery stores or lumber yards and those kind of things, because we need supplies for specifics, the percentage of people that are not wearing masks, including the staff, is doing better, and the business is doing better with that PPE. However, people are still walking in and out without those masks. So that is going to be our future. And so we as an industry should be leading that to make sure that every one of our employees are wearing those masks if social distancing is absolutely not available. And even in social distancing, folks, we all know that a good sneeze and a good cough can travel up to the aerosol droplets can travel 27 feet, as they've done in studies. They actually did a study on CNN where they showed a plastic or a dummy sitting at an end of a table, and they projected dyed air droplets. And yes, it goes 27 feet. So sanitization, what does that look like for your organization? What's the frequency? What is your traffic flow? And what are you going to be actually sanitizing? So we'll talk about that as we go further into the step-by-step, how we can accomplish that, what we should do, how we should plan in that. We're hearing of reduced wages, time, even with the subsidies available at 75%, where the government strongly suggests that we pay the 25%, but there are companies and organizations that are just paying the 75% with reduced hours as well. And in some cases, those reductions have been very, very significant. And so that's going to affect or could affect worker morale. And so with all of these things, that's going to be a challenge to make sure that we motivate our people to do the best they can under the circumstances to meet our new criteria protocols. And that will take some oversight and leadership from our organization's management. My wife is going back today for the first time in 2 months. So things have changed as well. And there's already a process where people are having to take stress leave because they are under tremendous pressure. I can just appreciate our frontline workers and those that have been the essential workers at the beginning of this, that there could be a lot of stress. So be prepared for that. Just make sure that you, as we talked in our last week's seminar, that you look after your mental wellness for your people by having a good conversation with them and ask the question, how are you doing today? Open door policy is crucial with that. And where is our consumer confidence level at the moment? I think everyone has taken a look at their financial pictures, and we're going to see that there could be some changes in the way that consumers spend on some of the items that we are providing for them. So that's going to be a unique challenge. All right, so let's get into some specifics on show home and room procedures. The first thing that we should be doing is a formal hazard assessment of the complete process. We should have done that. Now, what I'm talking about is to take a look at your facility, who is working there, who is going to come there, and assess the risk from a COVID-19 community transmission prevention opportunity. And so you're going to have to create some safe job procedures, right? They have to be specific to the location, what it looks like. You're going to have to do some planning and figuring on all of the things that need to go through on how to let people enter your facility in a safe and yet a productive manner. So, according to what I understand from my research in the last couple of days, that there's only 15 at a time of people allowed inside a facility, and I believe 50 outside gatherings. So you need to determine how best to look after those individuals while showing them what your wares are, what you're trying to accomplish from a production point of view or a showroom, show home, because you're also going to be dealing with salespeople. And so the focal point of salespeople, of course, is to sell. And that's their job. That's the reason that they're there. And that's why we need to make sure that they have clear understanding of those procedures, and an orientation should be done to make sure that they clearly understand what your expectations are. And they need to be trained on that. And this is part of your formal hazard assessment, because one of the things that occupational health and safety is now doing as well is, of course, looking at all of the hotspots, and they're checking, have you done your protocol? We have heard of one of our people we look after that they had a COVID-19 transmission issue on their site. OH&S came and where are your procedures, shut the site down, and all of the workers, and there were 5 more of them, 14 days into isolation and follow through. So OH&S is a vital part of the accountability process. And so you want to make sure that you've got your due diligence taken care of. First, of course, we don't want anyone sick. Second of all, we want to look after the due diligence of our organization's responsibilities. So employee PPE. The situation is that we need to make sure that our workers, our management supervisors, are protected. They need to have the information to keep themselves safe. They need to make sure that they've got PPE that fits, and they need to understand they need to wear it. And then, of course, we need to look at the sanitization of all of that stuff, whether single use, reusable, and each of those has specific protocols to be followed. And they need to be followed, folks, because it is so easy to be in a situation where someone is asymptomatic and that transmission can happen at a moment's notice. The virus is it doesn't matter who you are, young, old. They're now looking into states where they're looking at infant respiratory distress syndrome, and they're finding that that could be related to COVID-19 transmission. So right from our aged people right to the young, genders don't make any difference. It's all about the underlying issues which the virus will find if there's a weakness in a person's system. So now, consumer PPE. And this is where we're also going to invite you in if you've had some situations with customers regarding wearing PPE in your facilities. The chat would be an awesome place for you to give us your information, because this is a collaborative effort. So signage can be excellent at the beginning. Please wear your PPE. You can have PPE available to them. Now, again, this is a cost, so you need to determine how you're going to manage that. But be prepared that there could be some pushback from customers, and therefore have some dialogue with your salespeople on how to invite them to wear it and why it is reciprocal. We're wearing our PPE to protect you. Is it possible that you could wear the PPE as well inside our location to protect us? So that is going to be an education. Society-wide, not just in our businesses, because it's not the new normal yet. We need to now start and saying thank you for those that are wearing it. There's nothing wrong with positive reinforcement. When you see someone that you're interacting with and they're wearing their PPE, say thank you so much for doing your best to protect me. And I think that positive influence can get those numbers of people wearing masks in our workplaces, in society, and because that's where we need to go. Now, sanitization in our show home rooms, you need to set a frequency. You need to set a procedure up where what you're going to disinfect. In grocery stores, they're now sanitizing after each customer leaves their specific checkout area. And so that sanitization has to be looked at for washrooms in your location. What kind of protocol? Usually there should be a situation where that should be for staff only. However, you may have a young child that needs to go to the washroom. I don't think anyone is going to deny that in their locations. However, if that takes place, this is an unknown quantity, an unknown entity, to make sure that that location then is sanitized. We'll talk about heavy traffic areas as well, depending on the frequencies. So, what does your pre-opening look like? There should be supervisory oversight of this. Is our place ready to go from not only a selling point of view, but have we got all of our protocols in place? Our crew, right? And this should be completed as a team so that it's shared effort, right? Whatever your sanitization post-shift or pre-shift is, let's make that a team effort so everybody shares the burden, because everyone is going to have to be aware of what's happening. And of course, we need to, as part of that, ensure that our workforce is fit for work. How are you doing today? Have you been exposed to anything that we need to know about? And again, we can just have a good conversation to make sure that everybody's ready to go. Traffic flow, depended on in a show home, that might be a little bit more difficult. You may want to have a waiting area for as a group comes in. You may want to determine that you're only going to let one group in at a time. Those procedures you can look at depended on. Social distancing is crucial, of course, PPE, all of that. And if you're having challenges, then you may also need a person at the front door to do some just guidance and control to make sure that that social distancing is happening. And again, as you're walking with your group or groups, try to do at least a 2-meter distancing. And you may have to recuse yourself from a specific location, especially a small bathroom or something like that, where you may not be able to distance and just let the group go in. And again, with this traffic flow pattern, we should debrief if we see bottlenecks or challenges and ensure that it is working. Now, the engineered approach is probably the best. There are large chains that have arrows on the floor, on the concrete floors and such, and sometimes that is not followed. So the barriers in one particular location I was at yesterday, there was an actual access and egress that was engineered in corridor style, so that there was no misunderstanding of what direction you needed to go to keep that social distancing. A lot of processes now in businesses have plexiglass separations. There are so many engineered devices that can be used to minimize that, dependent on your situation. So really need to look at that. And of course, all of this needs to be overseen by supervisors to make sure that they do regular inspections so that all of those things are maintained. And so what to sanitize? Well, I can just appreciate in a show home, right, that people want to tactile touch stuff. Now you can just see that those areas could become, if there is COVID-19 in their group somehow, that could be that community transmission process. So you're going to need to determine, and it will be also determined by how many people come through your facility, how often and what you're going to sanitize. And so there needs to be some I know that the words common sense don't always sit well with people, because, so we'll talk about common knowledge. Let's have some protocol with the amount of numbers that come through, because the more the numbers, the more opportunity for the community transmission. So we need to make sure that if there is a specific area that gets heavily frequented and touched, and that particular area may need to get sanitized more frequently. So as your COVID-19 show home or showroom plan, those frequencies based on the numbers, you should have a specific plan, and even have a laminated sheet for your salespeople and your workers, whoever does your sanitization and disinfecting, that they can clearly, easily see, you know what, we've had 50 people through here, let's take a moment and let's sanitize, right? So those procedures you will need to look at from your own business perspective. And again, it's going to take time, it's going to take effort, but by doing that, we can have a safe workplace for all. And then, of course, post-shift, we want to make sure that if we've had if we're sanitizing, that if we're using those cloths, if we're using those single-use towels with good sanitizers, then we should have containment or containers specifically designed for COVID-19 disposal. That is in a specific place, which then, after everything is put in the garbage bin or whoever's disposing that actual disposal area gets completely fumigated or sanitized. So this is the one thing that I think we're going to also talk about in our warranty and service, because in this case, you've got the community transmission coming to your facility. In the warranty and service, we may be taking it from place to place, so we want to have a good process. So also, we need to want to make sure that we give our workers good information on what they need to do as they go home. One of the things that our family is now working on is to have a containment area. My wife is working in a dental office, which is a high-risk environment. They've put procedures into place, but we're going to put procedures in place here to make sure that we minimize the containment and then sanitize so that we don't bring it into the most safe place we have, which is our home. And I think we need to have that conversation with all of our workers again to make sure that they don't give their loved ones or the people that they're living with or their space an opportunity for community transmission. And this includes in our vehicles as well, that if we are traveling and we have PPE because of we have more than one person traveling, then we should have some form of containment and disposal and sanitization procedure for our vehicles as well. So, and again, this is just an activator of thought so that we can do our jobs very, very effectively, profitably, but also in the most safe manner that we can. So now, warranty and service. This is a little bit of a different process as our workers are now going into people's locations. So I want to give a shout out to Chris Boyer from Jertine Interior Services. We've had some good conversations. Some of the information I'm sharing with you has been developed by Chris, and he has given us permission to share this with you, and we've injected it into our particular presentation today. So the first thing is communication. I think it's very crucial that when a customer calls you, that they have some form of warranty or service needs, that there's clear communication of expected behavior, both stating how your employee is going to conduct themselves, but also what the expectation is of the homeowner. Now, one of the things we also need to look at, a calm and confidential conversation. What happens if this particular home has a frontline worker in it? Now, I know confidentiality and privacy is always a delicate situation, but what happens if one of your workers goes into a person that works in the ER? The level of risk just went up, and that also could now look at it where a worker may do their right to refuse. So the better communication, the better clear expectation of expected behavior, both from so that everyone has a clear understanding what happens when your employee comes into their home to do the warranty work or service furnaces, plumbing, those kind of things. So a basic hazard assessment should be done as well prior to entering the location to make sure that the worker is safe, that they feel comfortable moving in and such. And of course, to make sure that they have the right PPE that is either single use, and I would recommend in this case single use PPE because of the various location that they go, because if they use a cloth washable, then they're going to have to replace that after they've sanitized themselves when they go to the next focal or to the next business or the next home in order to minimize that community transmission. You can see that this is high risk. Yeah. So the biggest thing is we want to make sure our workers are safe. We want to make sure our customers are safe and that there's a level of comfort there. So social distancing should also be part of this process inside the home, that as the worker goes, enters it, that there is proper social distancing, that they can go to the location where they need to do their warranty and their service, that they're safe. They may have to sanitize that location where they're working prior to and after. and of course their tools need to be sanitized, and that if there is disposal required, and to make sure that they are safe, so a containment area in their vehicle, in their van, in their truck, so that they can look at that PPE and put it away if they need to, and at the end of the day dispose of that in a safe manner. Again, there's going to be lots of variations to this theme. The biggest thing is we need to empower our technicians, our service people, to make good judgment, and when in doubt, that they either connect with you on how to deal with it, or step back out of the home site in order to not get sick, or transmit that as they go to the next locations. And again, this is a conversation. So we'll have some more discussion on this at the end of our presentation, because I think this is a very important focal point, because if your warranty or service person does anywhere from 2 to 10 locations, you can just see that entering spaces, leaving spaces, can now have opportunity for that community transmission. And so those are some of the things. Now, let's take a look at our second wave information. This is the last information we'll be dealing with this morning. There's COVID fatigue out there, folks. People are sick and tired of being sick and tired of this whole process. I recognize that. And now is the time that we need to be most diligent. As we see our neighbors to the south, there's a lot of stuff going on that just absolutely, I thought I was past being shocked, but they're having protests, they're having rallies, they're not socially distancing. They're the one process, even in our parks here in Canada, we've seen a lack of social distancing. People are tired of being cooped up. I get it. And this is also some of the social unrest, and the information we've been researching. We recognize that the government is very cautious about doing a second lockdown when that second wave could hit. And there's now, even right now, they're concerned that it could be a whole lot sooner than the fall, that as early as June and July, late June, July, that second wave or second peak, as we open the economy to phase 1, 2, and 3, that if those spikes occur again within our society, that there could be some more localized or containment, isolation, and those kind of things. So that fall flu season could be a whole lot earlier without flu, just because, but then of course in the fall we may have to look at that. And so the potential isolation and partial shutdowns, they could be also part of this, and that could be localized, or that could be citywide, just depending on what's happening. But I know Alberta Health and Canada Health are very concerned about that second wave. And so with the pandemic of 1918, the second wave was 5 times as prevalent as the first one. Now, we have a whole lot better communication, better tools, better medical systems. So those numbers most likely won't be that high, but there is an opportunity. So last thing that's now being looked at is the testing and tracing that's going to be required should there be a COVID-19 case in your organization. So the government of Alberta, and I've placed it on my phone to see how it works. It's now app tracing Alberta, which allows you to get notifications and gives an opportunity for the government to make sure that should there be a transmission, that people get notified that may have had contact of those individuals. So that is my presentation today, ladies and gentlemen. I want to thank you for your attention. I know that we are in unprecedented waters. We're doing things we've never done before, and the conversations that we're having, not only with our own organizations, with other like-minded people such as health and safety professionals, our owners, and such, is what's going to get us through. So thank you very much. Brian?
Thanks, Ernest. Very much. You've done a number of these, and you're quite the one-man show. We may have to book you on Broadway after this here with how you've been carrying these. So very well done. There are a few questions in the chat, some of which were all published out, and then one that I started to try and compose there into the chat for one of the members who had sent me one, and my fat fingers got in the way, but I'll verbalize it here. But let's go to the first one from Kevin. I think he's kind of asking about more broadly what's the bigger approach here and how is it helping us. And so what's the objective of the PPE effort? Does it flatten the curve or eliminate the possibility of transmission? Is this more an effort of optics than, I think what he's saying, than actual protection? And how does this affect us in terms of kind of getting us to the end of this whole process where everyone's, I know that that's a pretty loaded and comprehensive question, Ernest, but I'm going to give you a crack at that here.
Okay, so Elaine also asked, I had not heard that these masks were required in public. The whole process of the masks, ladies and gentlemen, is that we're protecting each other. We will not have a complete open economy until we have either have remedies to assist us in beating the illness. But we will not, this whole focal point is all of the factors that you're doing. It's to protect our fellow citizen, our workers, until we get to that vaccine. Because the challenge with what you're stating about the herd immunity, right now, the fatality rate is around between 6 and 8%, dependent on where you are. And so we have an opportunity to reduce those numbers. And I think it should be part of our mindset to, I know that we want to protect our families, do we not? I know that we want to protect our workers. So herd immunity is a wonderful statement. I don't like the word herd. I think societal immunity to me is much more productive. But how many people have to die to get that? So in Scandinavia, the two countries, Norway and Finland, have done social distancing, and Sweden did not. And the numbers are staggeringly different. The minimization for Finland and Norway are in the low numbers, but Sweden is exponentially higher. So the whole purpose of social distancing, wearing masks, is to minimize and stop people from getting the COVID-19 virus. This is a highly infectious virus. So SARS, which we had in the early 2000s, had an R naught of 2. So an R naught of 2 means one person, the numbers show that will infect 2. With COVID-19, that number is of 5.7. So one person has the opportunity to infect 6 people. So it's exponentially much more contagious. And we can't, and each person's illness is to that individual. It's not, oh, this will get you this sick, so this remedy will work. That's why it's such a challenge for our health system, because each individual person has to be a myriad and plethora of remedies in order for them to minimize the damage. And some of the long-term damage of COVID-19, we're just starting to see. There's still people that are having scarred lungs because of the infection process. And so we don't know what the long-term ramifications of that as well. So the whole purpose of masks and social distancing is to minimize transmission. And if we minimize transmission, we have the opportunity to save lives. And that, to me, folks, isn't that what we're all about, is to save lives, whether physical or from a health perspective. So yes, a mask can really assist that if we all do it together. I know that's a long-winded, but that's the statement.
Thanks for that, Ernest. I think there's 2 streams of questions coming out, one from Elaine and then another that's been put in here from Nicole. And maybe let's deal with Nicole's first, and then we'll come more specifically to Elaine's. Nicole has asked, what about the liability of mandating clients or prospective clients to wear PPE as they come to show homes, first of all, and then do you see this becoming kind of a new norm? And we're, the good old influenza season is coming up, and how's all this going to kind of intersect going forward?
So sidebar on the influenza, if people are not coughing on you and you're washing your hands and you're distancing, you're also going to have an opportunity to prevent the good old flu. Until age 60, folks, I never took a flu vaccine. Last year was the first year that I took that, and to this year it's going to be no different. I will immunize myself to the influenza opportunity, because I so believe that because of my own underlying health conditions, which are just normal, I cannot personally, and I'm speaking for myself, have the flu and then get an opportunity to get COVID-19. So mandating, well, you're going to determine with your organization what your line in the sand is. If you can safely protect your workers and the people that are coming into your show home without these masks, right, then it's going to require other protocols. The social distancing is then an absolute. You are going to have to refuse if someone's sick and coughing. So because that is going to be the new normal. But I would recommend that you put a sign up in your location, and state, we respectfully request that you come in here and accept our PPE for you because we want to keep you safe. And again, we need to educate people. It's going to be a continuous education. So if they don't wear it, you need to determine, well, do I want you in my place of business, or can I protect my workspace and you to make sure that you can come through our space and then leave, and that we can then sanitize, or we can then mitigate the opportunity for COVID-19 transmission. It is going to be the most difficult, but I think that as an industry, if we start educating and collectively make a good decision to say, you know what, this is our expectation. So once we start seeing those expectations, it's only going to require that as soon as we get more than 50% of people wearing masks in our society, it'll become the new norm.
Ernest, Nicole has a follow-up question, and this might be more of a legal one that will be tough for us to answer definitively, but she's really kind of driving at what liability does an owner take on if they provide PPE? And I think what's implicit in that is if they provide PPE and somehow somebody gets sick. Maybe just provide a little bit of commentary on that, and I might chime in at the end.
Yes, well. No, I appreciate that, Brian. We'll work together on this. The biggest thing, if you're doing your due diligence by having done your formal assessment, having trained and orientated your people, they are consistent in following those protocols. You're sanitizing your particular location. You are offering them PPE. Then you're doing everything what's reasonable and practical to meet the legislated requirements. You can, and please forgive me for this analogy, you can lead a horse to water, but you can't make them drink it. What you can do is make sure that the water you're giving them an opportunity to drink meets all the requirements under government legislation. So if you're doing that, because remember with occupational health safety legislation, it is strict liability where the onus of verification that you did everything reasonably practical to ensure the safety. So that's, if you're doing that, then you're meeting that requirement. The legal ramifications, which I don't think you'll be in. No, I'll stop right there because I'm not a lawyer and I'm not going to go into that. When you clearly state, please enter, and we expect you to wear those masks, and they don't, you've done everything you can to meet the requirement. I hope that makes sense.
Thanks, Ernest. And Nicole, I would just say, much as Ernest added there, at the end of the day, the measure is, have you done all things you reasonably could to mitigate out the risk and hazard that there's there? And to the extent you've taken those steps, I think that it would be difficult for someone to say that you have somehow crossed the line in not providing appropriate safety for your clients and for your workers. So I think that's a good piece. And also Elaine from McKee Homes has chimed in that, you know, if you put that along with social distancing and all of the controls that you've had done, I think it's going to be pretty tough to say, for anyone to say that you didn't take all reasonable steps. So I hope that's helpful to you. I don't know, Ernest, if you have anything to add to that.
Well, remember, each individual is still responsible for their own safety as well, including customers. What did the individual do to work with you, right, in order to make sure that not only that they're safe, the people that are with them are safe, but that they have not subjected your workers to unsafe conditions, right? So you're doing everything that you're supposed to be doing, then you've met that criteria from a liability point of view, right? The only thing that we want to make absolutely sure is that we have our workers understanding that if they're in a situation that where they do not feel safe, that they have that right to refuse, but they also have the right to ask a customer to leave, right? Because if you've got a customer that becomes belligerent, that is now a whole different perspective than just wearing a mask. So we should have an emergency response plan as well, what to do in case of unruly or belligerent individuals.
Thanks, Ernest. Maybe just one last thing on these masks, and the question just plain out is, where are masks required? And there are kind of two streams of masks. There's the kind of N95 surgical mask, and then there's the not N95. That's probably not a very technical way to express it, but the not N95. Can you just give us your thoughts on where they are required? And I think there's some resources on the Alberta government site, but
Yes.
where they are required, and the difference between these N95 masks and the rest of them.
Absolutely. Well, just to bring this into a sort of a whole picture, the situation is that social distancing, when you're working in real life, sometimes those boundaries get crossed very, very easily. And that's just normal human interaction. Could you show me this, please? And you're just so focused on trying to sell something or to show or to provide service, and your focal point goes on the task rather than minimizing your risk opportunity. So this is where the mask is going to come in to give you that more freedom. Yes, social distancing is a very capable opportunity, with the exception of coughing or sneezing. And that now looks at 27 feet, right, rather than the 6.5 or 2 meters. So the reason that we're looking at mask opportunity is, when you wear your mask, you're protecting someone else. If they wear their mask, they're protecting you and those in the facility. Now, N95 is an excellent mask. In some cases, they can be less comfortable. You may have seen some of the pictures of the healthcare workers who are totally PP'd up. And there was one very graphic picture where the area around the nose and the cheek area was bruised because of wearing these tight fitting masks for 8 to 10 to 12-hour shifts. So I recognize that may be in high risk situations at an N95. In a low risk situation where you're in a show home or such, a good fitting cloth or surgical mask can be where they can be comfortable to the point where they don't bruise, and they can be more than sufficient. So we need to look at what risk are we being exposed to. If we're in a high risk environment, the level of PPE should be, again, risen as well. And in some cases, we may need respirators. Do I see that in a show home or showroom? I don't think so. Do I see that in a high risk environment where you've got people working in a space closely together? I can see that. So this is where our assessment, our training, our observation, our awareness comes in of what type of mask we're going to wear. But remember, if you're wearing cloth washable masks and you're wearing for the full day, after that you need to sanitize, either wash them. You cannot put them on and off. They need to be worn completely all day, unless you have a new one available that you can then put on after you've sanitized your hands and for 20 seconds, or with sanitizer, so that you're putting a clean mask and that your face is clean as well. Because even you do not know whether you've been exposed to COVID-19. I hope that makes sense.
Thanks, Ernest. Ernest, I want to just change direction a little bit here in kind of the nature of the questions. Throughout your presentation, there's a thread around hazard assessments and that process, and maybe just you could start us off, and there are a few questions I have in this line here. Just start us off for a space that is very highly public interactive, where it's certainly easy to develop a hazard assessment for staff and coach them up, if you will, on the hazard assessment. But where you have a high interface with the public who's may not be in tune with that process, what are the particulars you have to pay attention to in your hazard assessment process in that regard, and kind of, if you will, engaging as much as possible the public that are going to interface with you into that process, and make sure that the hazard assessment is works for that certain situation?
Yeah. So what I would do is when you open your showroom and showroom, and it may already be open, what I would do is a case study. I would get one of the staff to be the customer and the other one, of course, the staff. And then take notes step by step, the flow of the process. So your presentation about the showroom or the showroom, and go through it and recognize where the choke points are. Is it the stairs? Is it the washroom? Is it the specific area where you've got your wares to be sold? So realistically, map it out how you expect behavior to happen real time, and put that on a formal hazard assessment document. Look at the level of risk at what stage where, and then to put those controls into place at those particular locations. I can see doorknobs, I can see cabinets knobs, I can see doors opening on dishwashers, etc. And those areas should then have a frequency attached to them to minimize. Now, you may have to say, I have to sanitize after every one. That may or may not be practical. It might have to be at set intervals. After 3 groups, we sanitize. You need to determine what's going to minimize that community transmission should there be exposure to COVID-19. And that needs to be documented. We need to train our people, and then we need to maintain our standards. And there's nothing wrong at the beginning of the presentation giving a 1-minute discussion and orientation to your customers as part of your sales pattern. Folks, we've got some sanitizer here for you. We have masks for your safety. We would like you to wear them if possible. And then follow them and make note of what areas they touch. And if you see specific areas get touched more frequently, then those are the ones that you're going to have to put controls into place to make that sense. I hope that makes sense, because this should be real, this should be practicable, right? And it should make sense.
Thanks for that, Ernest. And you may have, in many respects, answered this question, both, I think, in your materials that you presented before and in that answer. But maybe just to get it straight out, are there any lessons to be learned from, say, the retail grocery industry or drugstores, which were essential services, much like ourselves, and have had to remain open since the get-go on this?
They have done their best to engineer the safety. A lot of registry offices as well, but a lot of businesses have now created plexiglass barriers to separate their workers from the customer opportunity or community transmission. I'm not sure that that's going to be available in a show home. Showrooms, yes. In a showroom and they're buying wares, they can have specific points for end of sale. In a show home, that may be more difficult. However, if people are sitting down writing contracts, there's nothing incorrect by having a plexiglass barrier between the show home staff and a customer. I think people are starting to recognize that. And so engineering is always the best. When it's not possible, now our procedures and PPE need to come into place, and they have to be looked after very stringently, of course, with disinfectant and those kind of things. So this is where an assessment of your location, what can I separate and where can I put procedures and protocols into place so that I can minimize that opportunity of COVID-19 infection.
Thanks very much for that answer, Ernest. You talked about this a little bit earlier in your presentation, but I wonder if you could maybe just elaborate. And it kind of lines up with the hazard assessment piece, and also what I'd call what's often called in the field the safety toolbox meeting, yes, which is not necessarily something that is a norm for the more retail side of our operations. How do we prevent as you called it, the COVID-19 safety fatigue from setting in, and what are some additional strategies that can keep this very much a fresh and active topic for employees, and also as people come to interact with our members and employees?
So first of all, we need leadership from everyone, not just management, not just supervision, but everyone. We need to make sure that our workers and our people understand the reason why we're doing it. When we give people the reason that makes sense, the opportunity for buy-in from them is much higher than when we put systems in place that don't make sense. So we need to look and have a checklist, and we need to have supervisory oversight. And yes, we need to be promoters. We need to be sort of cheerleaders to keep our people in the game. And we also need to make sure that our workers know that they are supported should they find themselves in a situation where they don't feel safe. Now, I know that there's always two sides to every coin. I get that. But if they don't feel protected from our organization, from unruly customers, then that could be a breakdown in our process. And this is where our toolbox meetings, our meetings in the morning, even just a one-on-one conversation, just by asking the question, how are you doing today, right? And be prepared for the answer. I noticed that you may be, is everything okay? You look a little down today. And we're not being invasive, but when we start caring about people to the level that we need to, in this case, and support them, I think that buy-in, and when our workers see that we support them 100%, they will make that. Now, the one other thing that we need to make sure is that they understand that this is the new normal moving forward. When they're comfortable with it, because you're comfortable with it, the customers will be much more comfortable with it as well.
Thanks, Ernest. One last question here, because we're almost out of time. Just regarding the disposal of used safety materials, is there any particular guidance on that for the typical types of materials that people in our show homes would likely be using, show homes and sales centers would likely be using?
Yeah, no, I've looked at that even this morning just to see if they talk a lot about PPE for frontline workers, but they've got very little information. The thing that we've thought about is that I would have it in one specific space and one specific containment container, if that's possible, whatever that looks like, and ensure that that's clearly marked, and as part of the orientation, that all of our workforce understands this is where we're going to dispose our COVID-19, clearly marked, and that procedures are put in place of how it is filled up by PPE. So this may have to be in a washroom, this may have to be in a change room, whatever that looks like. But that needs to have a great focal point on sanitization procedures, so that minimizes also the interaction of who disposes that. That should be minimal as well, and to make sure that they have sanitization processes for themselves, as well as the containment area and containment facility. Also, we need to look at our vehicles, that workers have containment areas there as well, to make sure that they minimize the opportunity for COVID-19 transmission.
Thanks for that.
Just appreciate warranty workers going from home to home, that they could be a transmitter if they don't have that decontamination process as they have left each location.
Thanks so much for that, Ernest. And thanks again for, I think what I'm going to dub is the Ernest Kremer's one-man show here. You've really carried a number of these meetings for us, and we're very grateful for that. I would just add that I did put in the chat a link as you were chatting in respect to the Alberta government, and I think there is some information on masks there. Now, I will tell you that I'm not the world's greatest typer, and we'll double check that and make sure that link is up on our COVID-19 resources site later today. It's looking like that certainly is all the questions we have this morning, and certainly all the time we have for questions. Thank you to everyone for logging in and listening to what we, and in particular what Ernest had to say, and special thanks to those who have contributed to the chat window. I encourage everyone to adopt the safety and wellness practices as a priority. The health and well-being of our industry and community is dependent upon our continued efforts as companies and individuals. I will point out that we will again at this same time next week have another safety forum, and we're fortunate to be welcoming Bill Black, the President and Chief Operating Officer of the Calgary Construction Association, who has been one of those leaders that Ernest referred to in terms of making sure safety procedures and protocols for COVID-19 have been developed. And once again, Ernest, thank you so very much for the generous gift of your time and professional advice to all of our members, and for really being a leader in this very difficult time. We're so very grateful to you, and we look forward to hopefully a time in the future where we can sit down to say face to face and share our genuine gratitude for all you have done. Once
My
again,
pleasure.
Thanks, Ernest. Thanks to all of you for taking time to participate this morning. Until our next session, please keep yourself and others safe. Have a great day and good luck this morning.